Premature ovarian insufficiency (POI) is a reproductive health issue. Look at this picture, shows that normal ovary and premature ovarian insufficiency. Look at this. Then ultrasound findings. Detail going on. Introduction. Premature ovarian insufficiency is a significant reproductive health issue that impact young people, typically under the age of 40. It is characterized by the loss of ovarian function, which can lead to infertility, early menopause symptoms, and long-term health consequences. Premature ovarian insufficiency (POI) refers to the loss of normal ovarian function in women under 40 years of age. Unlike menopause, POI is not always a complete and reversible loss. Ovarian function may intermittently return, allowing for the potential of sporadic ovulation and rare pregnancies. Types. 1. Primary POI caused by inherent genetic or structural ovarian abnormalities. 2. Secondary POI results from external factors such as chemotherapy, radiation, autoimmune diseases, or surgical interventions. Causes. 1. Genetic factors. Mutations in genes like the FMR1 gene linked to Fragile X syndrome can increase the risk of POI. 2. Autoimmune diseases. Conditions like autoimmune thyroiditis and Addison's disease can attack ovarian tissue. 3. Chemotherapy or radiation therapy. Cancer treatments often damage ovarian follicles. 4. Infections. Rarely, infections such as mumps can impact ovarian function. 5. Surgical removal of ovaries. Oophorectomy or surgical removal of ovaries results in POI. 6. Idiopathic. In many cases, the exact cause remains unknown. Risk factors. 1. Family history of POI. 2. Genetic disorders like Turner syndrome and Fragile X syndrome. 3. Autoimmune diseases, example thyroiditis, 4. Exposure to chemotherapy or radiation therapy. 5. History of ovarian surgery. Complications. 1. Infertility. Most prominent complication due to reduced egg production. 2. Osteoporosis. Estrogen deficiency leads to higher risk of bone density loss. 3. Cardiovascular diseases. Low estrogen levels contribute to higher heart disease risks. For mood disorders, high prevalence of depression and anxiety. 5. Cognitive decline, possible increased risk for dementia due to estrogen deficiency. Pathophysiology. POI involves diminished or depleted ovarian follicles, which leads to reduced estrogen production and increased level of follicle stimulating hormone FSH. The hypothalamic pituitary gonadal axis responsible by increasing FSH production to stimulate the ovaries, but the lack of follicles prevents a normal response, leading to persistent estrogen deficiency. Here is step-by-step breakdown of the pathophysiology of premature ovarian insufficiency POI. 1. Reduced follicle number or function. 2. Insufficient estrogen production. 3. Loss of negative feedback on the hypothalamus and pituitary gland. 4. Increased gonadotropin releasing hormone GnRH release. 5. Elevated FSH and LH levels. 6. Inability to achieve follicle maturation or ovulation. 7. Persistent estrogen deficiency. 8. Systemic effects on estrogen deficiency. Estrogen plays essential roles beyond reproduction. Chronic low estrogen levels affects various organs and systems. Bone health. Reduced estrogen leads to increased bone resorption, making bones weaker and prone to osteoporosis. Cardiovascular health. Estrogen deficiency is associated with a higher risk of cardiovascular disease. Mood and cognition. Low estrogen levels are linked to mood swings, depression, anxiety, and cognitive decline. The primary pathophysiological process in POI begins with deficiency or dysfunction of ovarian follicles, which results in low estrogen levels. This disturbs normal hormonal feedback loops and has systemic effects due to estrogen's roles in multiple body systems. Signs and symptoms. 1. Irregular or absent menstrual periods. 2. Hot flashes and night sweats. 3. Vaginal dryness and painful intercourse. 4. Mood swing and irritability. 5. Decreased libido. 6. Fatigue and difficulty concentrating. Diagnosis: A. Medical history and physical exam, assessing menstrual history, family history, and other symptoms. B. Laboratory tests. 1. FSH and LH levels. Elevated FSH levels 40 mlu per ml in a young woman often indicate POI. 2. Estradiol levels. Low estradiol levels supports the diagnosis. 3. Autoimmune testing, detecting antibodies if autoimmune cause is suspected. C. Genetic testing, identifying genetic abnormalities such as Turner syndrome or Fragile X mutations. D. Pelvic ultrasound used to assess ovarian size and follicle presence. Nursing diagnosis: 1. Risk for infertility related to ovarian insufficiency. 2. Risk for osteoporosis related to estrogen deficiency. 3. Anxiety related to diagnosis and infertility concerns. 4. Imbalanced nutrition less than body requirements related to weight loss from POI. 5. Risk for activity intolerance related to fatigue. Management: medical management: 1. Hormone replacement therapy HRT. Estrogen and progesterone are prescribed to alleviate symptoms and prevent complications like osteoporosis. 2. Bone health management: calcium and vitamin D supplements along with exercise and advice to prevent osteoporosis. 3. Fertility options: egg donation, in vitro fertilization IVF, or adoption can be considered for women desiring. 4. Psychiatric support: mental health support is provided to address depression and anxiety. Nursing management: 1. Patient education, teach about POI, its impact and management options. 2. Symptom monitoring, regularly assess symptoms such as hot flashes, mood changes, and bone pain. 3. Psychosocial support, provide counseling support to address psychological impacts like body image and fertility loss. 4. Bone health promotion, encourage weight bearing exercises and adequate calcium vitamin D intake. 5. Lifestyle modifications. Advice on smoking cessation, maintaining a healthy weight, and reducing alcohol intake. Treatment. 1. Hormone replacement therapy (HRT) provides estrogen and progesterone to relieve symptoms and protect against osteoporosis. 2. Fertility treatment. Assisted reproductive technique and technologies like IVF with donor eggs may be an option. 3. Bone health management. Calcium, vitamin D, and bisphosphonates if osteoporosis develops. 4. Psychiatric medication. Antidepressants or anxiolytics can needed for mood disorders. Psychosocial medicine. 1. Support groups. Connecting with others facing POI for emotional support. 2. Counseling. Individual or couples therapy to address psychological impact. 3. Coping strategies. Mindfulness, stress management, and resilience building. Practices. Prevention. 1. Genetic counseling for individuals with family history of POI or genetic disorders. 2. Autoimmune disease management. Early diagnosis and management of autoimmune disease may reduce risk. 3. Protective measure in cancer treatment. Techniques like ovarian shielding and cryopreservation to protect ovarian function during chemotherapy. In conclusion, premature ovarian insufficiency is a complex condition that affects young women's reproductive health, physical well-being, and psychological state. Early diagnosis, effective management, and holistic care can mitigate its impact, improve quality of life, and offer reproductive options for those affected. Thank you. Have a nice day.